What are the most common health problems hidden beneath the silky, elegant coat of a Balinese cat, and how can you easily protect your pet from them? Hi, welcome back to Paw and Order. My name is Carl, and today we are shifting our focus to a vital topic that every single lover of this beautiful breed needs to know by heart. While Balinese cats are famous for being incredibly playful, chatty, and long-lived companions, their specific genetic heritage makes them prone to a few distinct medical conditions throughout their lives. As a dedicated pet parent, understanding these hidden vulnerabilities is the absolute first step toward ensuring your furry family member enjoys a completely vibrant, pain-free life. Today, we are breaking down these common health issues into simple professional steps, so you can recognize early warning signs right at home. By mastering this essential knowledge, you can act fast, partner effectively with your local veterinarian, and create a highly protective daily routine for your beloved feline friend. To build a solid foundation of understanding, we must look closely at a serious cardiac condition, called hypertrophic cardiomyopathy, which is often shortened to HCM by veterinary professionals. This specific disease causes the muscular walls of a cat's heart to thicken abnormally over time, which severely limits the heart's natural ability to pump fresh blood efficiently throughout the body. Because this progressive thickening happens quietly on the inside, a Balinese cat might appear completely healthy and highly energetic on the outside, while the condition is silently developing. To protect your cat from this hidden threat, the single most effective step you can take is to request a regular cardiac ultrasound, also known as an echocardiogram, during their annual veterinary checkups. Catching this structural change early allows your vet to prescribe protective daily medications that support heart function, reduce stress on the cardiovascular system, and significantly extend your cat's life. Another major health area that requires your close attention is progressive retinal atrophy, or PRA, which is a genetic eye disorder that slowly degrades the light-sensitive cells at the back of the eye. This unfortunate condition typically starts quite subtly, with night blindness being the very first symptom, meaning your cat might suddenly hesitate to walk into dark rooms, or accidentally bump into furniture after the household lights are turned off. Over several months or years, this degeneration can slowly expand into total daytime blindness, changing how your feline companion interacts with their physical environment. Fortunately, modern science has developed a highly reliable simple DNA swab test that professional breeders can use to identify carriers of this specific gene before passing it on to future litters. If your cat does develop PRA, you can easily support them by keeping your home layout completely consistent, placing stable non-slip rugs along their favorite paths, and avoiding moving heavy furniture. Moving down from the eyes to the mouth, Balinese cats are exceptionally prone to developing early periodontal disease, which is a serious inflammation of the gums and teeth, caused by rapid plaque buildup. Because these cats have slightly elongated, narrow facial structures inherited from their Siamese ancestors, their teeth can sometimes be crowded closely together, creating perfect hidden pockets where harmful bacteria thrive. If left completely untreated, this bacteria can cause painful gum infections, tooth loss, and can even enter the bloodstream to damage vital organs, like the kidneys and liver. The easiest way to prevent this painful cycle is to establish a simple tooth-brushing routine at home, using a pet-safe toothbrush and delicious poultry-flavored toothpaste, at least 3 times every week. Additionally, providing specialized dental crunchy treats, and scheduling professional veterinary teeth cleanings once a year, will keep their breath completely fresh and protect their overall systemic health. We must also talk about a unique behavior-related condition, known as feline hyperesthesia syndrome, which is a complex neurological and dermatological disorder that causes extreme skin sensitivity. A Balinese cat experiencing an episode of hyperesthesia might suddenly start biting, or scratching frantically at its own tail or lower back, as if they are trying to escape an invisible bug. You might also notice the skin along their spine visibly rippling or twitching, accompanied by loud, distressed meowing and sudden bursts of frantic running across the living room. To help a cat suffering from this condition, the best step is to minimize daily stress by maintaining a strict, highly predictable feeding and playing schedule every single day. Veterinarians can also provide great relief by prescribing specific calming supplements, or nerve-soothing medications, that quiet the overactive neurological pathways, restoring peace and comfort to your cat's daily life. Next on our safety checklist is a serious respiratory condition, called feline asthma, which causes a cat's lung airways to become chronically inflamed, swollen, and tightly constricted. When an asthma attack happens, your Balinese cat will typically crouch very low to the ground, extend their neck straight out, and make hacking or coughing sounds that look exactly like they are trying to cough up a stubborn hairball. This condition is usually triggered by common airborne irritants floating around our homes, such as strong scented perfumes, dusty clay cat litter, cigarette smoke, or aerosol cleaning sprays. You can easily protect your cat's sensitive lungs by switching to completely unscented, dust-free paper or pine cat litters, and running a high-quality HEPA air purifier in the rooms where they sleep. For long-term medical management, veterinarians can successfully prescribe specialized feline inhalers, or oral anti-inflammatory medications, that open up the airways quickly during a flare-up. As your beautiful Balinese cat transitions into their golden senior years, keeping a watchful eye on their delicate kidney health becomes an absolute top priority for every pet parent. Chronic kidney disease is a very common ailment in older felines, where the kidney tissues slowly lose their natural ability to filter out toxins and waste products from the bloodstream. The earliest, most obvious signs of this internal decline are a sudden, noticeable increase in how much water your cat drinks, and a corresponding increase in the size of the wet clumps in their litter box. To support their hard-working kidneys, you should proactively transition your cat to a high-quality, moisture-rich wet food diet rather than relying solely on dry kibble, as extra hydration is critical for flushing out waste. Regular veterinary blood tests and specialized low-phosphorus senior diets can also work wonders to slow down the progression of this disease significantly. Another metabolic condition that can quietly emerge in adult Balinese cats is feline diabetes, which occurs when their body can no longer properly produce or respond to the hormone insulin. This insulin deficiency prevents their cells from absorbing vital energy from food, leading to dangerously high sugar levels in their blood, and a sudden unexplained loss of physical body weight despite a massive increase in appetite. The absolute primary risk factor for this metabolic disease is obesity, which is completely preventable through careful portion control and active daily exercise routines. You can take charge of their health by accurately measuring their food with a digital scale, instead of guessing and ditching free feeding bowls in favor of interactive puzzle feeders that force them to move. If diagnosed, diabetes is highly manageable through daily insulin injections and low-carbohydrate diets, and many cats can even enter full remission with prompt care. Let us now explore a less common but deeply serious neurological condition, known as lysosomal storage disease, which is an inherited genetic disorder that occasionally surfaces within the Balinese breed family. This condition happens when a cat's body lacks a specific essential enzyme needed to properly break down natural cellular waste products inside their nerve cells. As time goes on, these unrecycled waste materials slowly build up to toxic levels inside the brain and spinal cord, leading to visible coordination issues, balance loss, and subtle trembling of the head or limbs. Because this is a deeply rooted genetic condition passed down from parents, there is unfortunately no current cure, making responsible breeding practices the single most important line of defense. When looking to welcome a new kitten into your home, always ask the breeder for comprehensive genetic health clearance documents to ensure these tragic nerve conditions are entirely absent. Ambidextrously moving along to their skeletal health, we must discuss a painful joint condition called patellar luxation, which occurs when the cat's kneecap accidentally slips out of its natural tracking groove during movement. If your Balinese cat is running around and suddenly starts holding one hind leg up in the air for a few steps before popping it back into place, they are likely experiencing this knee instability. While mild cases might only cause an occasional, brief limp, severe cases can lead to chronic joint inflammation, premature arthritis, and long-term mobility challenges that make jumping very painful. To protect their joints, it is vital to keep your cat at a lean, healthy weight to reduce unnecessary physical strain on their knees, and provide soft, cushioned steps to high surfaces. For advanced cases where the kneecap is constantly dislocated, a simple surgical procedure can easily smooth out the bone groove and permanently restore steady movement. We must also turn our attention to the liver and recognize a serious condition, called hepatic lipidosis, which is more commonly referred to as fatty liver disease by pet owners. This life-threatening condition almost always happens when a slightly overweight cat suddenly stops eating food for more than 2 consecutive days, due to stress, illness, or a sudden change in diet. When the cat's body enters starvation mode, it rapidly mobilizes its internal fat stores, and sends them straight to the liver to be processed into quick energy. However, a cat's liver is not designed to handle such a massive influx of fat all at once, causing the organ to become completely overwhelmed, swollen, and functionally impaired. The clear warning signs of this liver failure include a yellowish tint to their gums and eyes, severe lethargy, and persistent vomiting. Preventing this requires ensuring your cat never goes without food, making any diet changes very slowly. Another unique condition to keep on your radar is the potential formation of painful urinary tract stones, which are solid mineral deposits that can develop inside your Balinese cat's bladder or kidneys. These sharp mineral crystals constantly irritate the sensitive lining of the urinary tract, causing your cat to make frequent, stressful trips to the litter box, while only passing a few painful drops of urine at a time. In severe cases, especially in male cats, these stones can completely block the urinary opening, creating a life-threatening medical emergency that requires immediate, urgent veterinary intervention. To completely prevent these stones from forming, you must maximize your cat's daily water intake by placing multiple fresh water bowls around the house, or investing in a flowing pet water fountain. The moving water triggers their natural desire to drink, keeping their urine dilute and continuously washing away loose minerals before they harden into stones. Let us also consider the overall health of their beautiful, long coat and skin, as Balinese cats can occasionally suffer from airborne or food-related allergies that cause intense skin irritation. If your cat develops an allergy, you will notice them grooming themselves completely raw, leading to bald patches, red scabs, and hot spots around their neck, belly, or base of the tail. These allergies can be triggered by common environmental factors, like seasonal pollen, household dust mites, or specific protein sources in their food, such as chicken or beef. To solve this discomfort, work closely with your vet to conduct a systematic food elimination trial, where you feed your cat a unique, hypoallergenic protein source for 8 weeks. Eliminating the offending allergen from their diet or environment will quickly allow their skin to heal, fully restoring their signature silky coat to its absolute full glorious beauty. To pull all of these professional safety steps together, the absolute most powerful tool you possess as a pet owner is the habit of scheduling comprehensive preventative veterinary care every single year. These routine checkups allow your doctor to listen closely to your cat's heart for subtle murmurs, feel their abdomen for kidney changes, and perform routine blood tests that catch diseases long before outward symptoms appear. Combining these professional visits with a highly attentive home routine, including daily dental brushing, precise weight management, and stress-reducing play sessions, creates an unbeatable shield of protection around your pet. Your Balinese cat relies entirely on you to be their visual advocate, their protector, and their health champion throughout their entire journey from a playful kitten to a gentle senior. Investing this consistent care ensures your brilliant companion stays happy, healthy, and by your side for up to 15 or 20 wonderful years. Thank you so much for investing your time with me today on Paw and Order, to learn how to expertly safeguard the health of the beautiful Balinese cat breed. If you found this comprehensive medical guide valuable, and want to keep discovering professional, easy-to-follow steps for raising the happiest pets possible, please smash that like button and subscribe to the channel right now. We would absolutely love to hear from you, so please drop a comment down below sharing your favorite health tips, or any questions you have about caring for your feline family members. Your engagement helps our community grow stronger, allowing us to spread vital pet care knowledge to animal lovers all over the world.